and could use. And we found that by simply folding it 4 times, it provided, tested by the electron microscope, a 20 micron mesh. These plankton are 200 and 300 microns. And by having a 3-year study undertaken whereby we used the agricultural experiment station ag extension agent phenomenon or model, we simply hired women, educated them or trained them on the filtration process and had them go out every week as a reminder to their assigned villages. And over the 3-year period where women then practiced this filtration, and it's important to note that it is about a yard of sari cloth that is then folded, used as a filter, unfolded, washed, and then dried in the sunlight so you get a disinfection. And with that, we were able to achieve, first of all, the demonstration of cleaner water, because on the left, it's cloudy and you can see things swimming, and we were able to educate the women to say, look, those swimming things are not so good for your children. And we were able to achieve then compliance, and scientifically, we were able to demonstrate almost 100% of the zooplankton on the left being removed from the water. And we achieved about a 50% reduction in cholera in the Madlab area where we carried out our 3-year study. We tracked down every case where they had been filtering, and were able to show that for nearly every case that occurred, that family had gone to another village for the holiday or to visit where they did not filter and had picked up the disease. So we could track down every one of the cases. The other aspect of it that's been fascinating is that we went back 5 years later to see whether this really was sustainable, were they continuing to practice. We found that it was rather difficult to show the efficacy. We did know the overall rate for the villages were down, but it was difficult to determine precisely families filtering and not filtering, because those who had not been part of the control group that is not filtering had learned about filtering, and so they were filtering. So it was very difficult. But what we did learn, which was even more interesting, was that for families living in the village area surrounded by families who filtered, were protected. And this is the herd effect that has been demonstrated in many other medical and environmental situations. So clearly, this simple filtration is effective. Now, there's a colleague at George Mason University who has developed a method for removing arsenic. And Dr. Hassan and I are teaming up to use this very simple technique, which he has designed, that costs less than, I think, $20, and is useful for up to 5 years, of being able to remove arsenic, and that we combined with the filtration, the Sari filter technique. And then if we could add very, very dilute drops of hypochlorite, one of the reasons they don't chlorinate is because the amount of organic matter is such you'd have to use so much hypochlorite that it tastes bad, they won't drink it. It's customarily it's not accepted. But with this kind of filtration, removing the organic matter and then removing the arsenic, and as you may or may not know, in Bangladesh there's a severe problem because the deep wells that were dug and funded through the World Bank, hopeful to improve better water, no one tested for arsenic, and it's very, very high arsenic content. So now there's an epidemic of arsenic-induced cancers and other ailments. In any case, the combination, we think, will be very effective. One last point I want to make, because I know I'm running out of time, is that we are analyzing also the molecular genetics because we are curious about the variations in pathogenicity that have been noted around the world for different populations. So we've taken 35 Vibrio cholerae and some related Vibrios and completely sequenced them, annotated and closed. And then in the analysis, and these are strains that were isolated in 1910, strain isolated from Sudan, from Iraq, from Chesapeake Bay, etc., globally. And there are some very interesting results. Firstly, indeed, these are comparison. The blue means lacking genes compared to a reference strain. It simply means that we can separate the cholera vibrios and we can track them. We now know that no single strain is identical to every other strain, and we can actually track the evolution of these strains in these different parts of the world. And final point, we've been using the O1 serotype to monitor the epidemic strain that causes the major pandemics. And we have discovered that, in fact, the genes for the that code for the serotype are laterally transferred. So what we have been tracking are only the genes for the serotype and not the actual strains. Furthermore, we have been able to determine that this bacterium undergoes genetic drift and genetic shift, just like the influenza virus. And that probably explains why it's been very hard to develop a vaccine to cholera, simply because the organism is able to shift its antigenic structure so easily. So I'll simply close by pointing out that when you look at any one thing in nature, you'll find it hitched to the rest of the universe. Thank you.
Thank you very much, Dr. Colwell. This was very, very instructive and certainly took us down to Earth. And from there, we're going to move to space. And Dr. Evan Thomas from NASA is going to tell us. Dr. Evan Thomas has been a civil servant at the NASA Johnson Space Center in Houston, in Texas, since 2004. And he works as an aerospace engineer and project manager at the Life Support and Habitability System branch on concept for sustainable Moon and Mars spacecraft. In other words, here we still have a supply of water. When you go to space, you have a very limited supply of water, and you have to live with that. And you're going to tell us how to do that. These include microgravity fluid management technologies and water recovery systems. Dr. Thomas is also a social enterprise executive and sustainable development engineer, designing and managing appropriate technology program in developing communities since 2002. Dr. Thomas has also worked in Nepal, Rwanda, Mexico, and Afghanistan with Engineers Without Borders, USA, and since 2007 as the founding executive vice president of Mana Energy Limited. Dr. Thomas, you have the floor.
Thank you. So I'm going to speak to you a little bit today about moving forward in terms of social enterprise and how it can have an impact on sustainable development. And I know we've heard a little bit about that here today, and I want to give you an example of what we're doing in partnership with some of our friends here at the UN. But before I start, I noticed earlier that there's actually a high proportion of younger folks attending this conference. And so I want to put a word out about that. Much of the work that you see here today that I'll be presenting was developed by undergrads and graduate students and young professionals over the course of the past 9 years, and we've now accelerated it to be an international business enterprise. And it doesn't take, it is certainly impressive to have 30 years experience. It doesn't take 30 years experience to have an impact today in the developing world. I'm an aerospace engineer at NASA, where I work on life support systems for Moon and Mars spacecraft. And at NASA, in my field, we are largely concerned with the same things that this conference is concerned with: how to keep people alive and healthy in a harsh environment with limited resupply, limited resources, very little training, and how to do that for a long period of time. The main difference, though, is we don't have gravity in space to help us keep the water in the bottom of the glass, and so we fly what is called the Vomit Comet. Everybody else calls it the Vomit Comet. We're supposed to call it the Weightless Wonder. It's a C-9 aircraft that's gutted on the inside, and it flies parabola straight up and down. And we're weightless for about 30 seconds at a time, and that's how we test our technology. I work primarily in Rwanda. In 1994, Rwanda suffered a genocide where over the course of 100 days, 1 million people were killed. This rate of killing exceeds that of the Holocaust and was the most efficient mass killing since the atomic bombs in Japan.